Hi there, John Farahmand from Balance Physical Therapy coming at you. I wanted to talk to you about something today that is a topic of frustration and, oh gosh, how shall we say this? Confusion sometimes for us as therapists and for our beloved patients. This morning I had the opportunity to evaluate this amazing woman who came in with her MRI, her X-ray, and some other lab results on paper that she'd been given by her doctor, and wanted me to read them. I had to read them, and I did, of course, after I'd done my chart review, brought her back just like we do with all of our patients at an evaluation. And the one thing that I kept hearing her say and go back to is, but my MRI, and but my X-ray says, and but my thing says. And what I want to message everyone out there in social media land today with is this: you are not your imaging study. You are not your X-ray. You are not your MRI. You are far more complex than those things and than what those results can demonstrate. And what I'd like to explain very, without going into too much minutia and quoting too much literature, clinical literature, if you're over age 30 and you've got positive signs of degenerative change, or what they call degenerative disc disease on your X-ray or MRI, congratulations, you're a normal human. So do I. So does everyone. But very few people have symptoms that can directly be correlated with what is seen or found on those studies. So please, if your physician or surgeon recommends some imaging for you because you're in a terrible pain, or because you fell down the stairs, or because you fell off your mountain bike, or you tripped in the grass, whatever it might be, and they sent you to an outpatient physical therapy clinic, that's a great thing. That means that typically you're not a surgical candidate right away, and that your physician or surgeon has confidence thinking that, man, they're going to be fine, they're going to be okay, and they're going to send you to an expert like us to make certain that you do everything possible to avoid going to their OR. So please, do not hang on to these objective findings on your MRI or on your X-ray if you were sent to an outpatient physical therapy clinic for care, because you are not your scan, okay? I'm going to share some personal information now. My C5, C6 disc space in my neck. My MRI says that I hardly have a disc left there anymore, and I've got something called neuroforaminal stenosis bilaterally. But guess what? I don't have any symptoms. I have no numbness, I have no tingling, I have no weakness, etc. My L5-S1 disc, the MRI scan says the L5-S1 disc space is nearly obliterated. Okay, and then they talk about ankylosis and all this stuff. That essentially means that I've got no disc left between my L5 and my S1. But guess what? I can still deadlift with 400 pounds when I work out. And I have no back pain. I am not my MRI. And neither are you. So please, remember that. Those studies are important, and they're used for a reason. But please do not grab on to every little line and every little positive objective finding on those things and obsess that you're not okay. You are absolutely okay. You are 100% okay, and you are not your objective MRI or X-ray finding. Please remember that. Thank you so much for listening. If you found value in this, please like it, please share it, and please visit us at balancept.com or on Instagram at balanceptmove. Have a great day.